Well, nationally, the U.S. has broken its single-day coronavirus death toll. According to numbers from Johns Hopkins University, more than 3,000 Americans died of COVID-19 yesterday. The average daily death toll has been around 2,200 in recent days. Yesterday also saw a new record of COVID patients admitted to the hospital. The COVID Tracking Project says that was nearly 106,700 people. Hospitals in several states reporting they're running out of ICU beds. And in Utah, we just went over 1,000 deaths from COVID-19. Now, substantially over that, 21 new deaths reported today leads us to 1,016 total. Fellow Utahns lost. And every day, we're showing you something really bland here because it's an email that we get from the health department that we then report to you. And this one is from November 21st. And if you look at the bottom of that screen, you can see a list of 14 people who died. But we just see an age range and a county. We don't see the people themselves. Look at line 12. It says male between 45 and 64, Washington County resident, hospitalized at the time of death. But that person is Mykal Hagler, 62 years old, a husband, father, and brother. Now, I've read a whole lot of tributes to him. You see his picture there right in the middle, that big smile. I want to turn to somebody who we all know, you know too, who knew Mykal really well. It's my friend and Fox 13 anchor, Bob Evans. And Bob, I didn't just want to tell people this number on this day that we get to 1,000 without recognizing that that's 1,000 friends and family members who are lost. So I'm really grateful that you're joining us. And Bob, how did you know Mykal?
Well, I'll tell you, first off, Max, thanks for having me on. Mykal and Terry, his wife, and Brandon, their son, have been dear, dear friends for as long as we've lived in our home. And they lived here in our neighborhood along with their parents, who are also dear, dear friends. And we got to know them decades ago and immediately fell in love with them. I mean, both Mykal and Terry are just the kind of people that you want to hang around and want to be around all the time.
I was, just looking at his pictures and reading the tributes, Bob. I mean, he just looks like he was so full of life, and he was pretty young. He was 62 years old, and so it sounds like he's just someone that people gravitated to. This must have been a shock.
Absolutely. Yeah, we all gravitated to him. I mean, he was such a great practical joker and had an incredible sense of humor that he'd have you in stitches all the time. And it was just something, it was a treat to be his friend, and you prayed for the next time you got to be around both Mykal and Terry. I mean, just darling, wonderful people.
It's, even the pictures they're showing, and these are pictures that I know his wife, Terry, who's a good friend of yours, shared with you. And those pictures, she clearly wanted us to see his joy and his sense of humor, posing next to a statue of a naked person, almost naked, playing the lute, and he's acting like he's playing too, or they're Where's Waldo together, that sort of thing.
Well, and here's the marvelous thing is, I mean, Mykal was terribly sick, and he didn't even know it. And both he and Terry came down with COVID-19. Their son Brandon had it first. And Terry's brother came over to their house. They live down in Ivins now. And he measured Terry's blood oxygen level with a pulse oximeter. And her blood oxygen levels were down in the 80s. Should have been in the 90s, down in the low 80s, they say. And Mykal told her brother, you got to get her to the hospital right now.
Because 80s is a big concern. That's dangerous.
It's a big concern. Yeah, but the bigger concern was that, and what they didn't know was that when they put the pulse oximeter on Mykal, he had not been feeling well. His blood oxygen levels were down in the 50s. Yeah. And so they got him in the car and down to the emergency room. He went immediately up to the COVID ICU unit at Dixie Regional, and that was on a Monday, and they struggled and struggled and struggled to keep him alive, and he was lucid all the way through. And talk about his sense of humor. They got toward the end, and he asked for the morphine.
Yeah.
And said, "Hey, wait a minute, though. I didn't get my final Pepsi."
Oh.
And
Oh,
every,
jeez.
everybody laughed. And the doctor asked him as he was giving the shot. He says, "Mykal, how's that feeling?" And he says, "Well, I'd rather be home right now, but this feels pretty good."
You know, it's
speaking of the morphine, you know. And,
oh gosh, it's the loss, and
Yeah.
and that's why I wanted to bring you on, Bob. And I'm so grateful for you taking this time. You know, usually we just trust you to bring us the news, and and here bringing you on personally. But I wanted people to see a friend who knows somebody who died.
Oh,
Yeah.
how we loved Mykal. And one last thing, because I know we need to wrap. Terry wanted me to express to everyone that they ought to have a pulse oximeter in every home, so that you can measure your own blood oxygen levels and know that if you get down out of the 90s, that is a dangerous place to be, and you need to get medical help right away. So a pulse oximeter in everybody's home.
Great advice. Yeah. My dad bought us one when this all started, and my dad, the amazing guy who I worry about because of all this. So Bob, thank you. I'll see you later today. You're working today, so I'll see you in a little bit. But thanks for being on the Noon.
You bet, Max. Thanks for asking.